Bonny Specker is an epidemiologist and professor emerita at South Dakota State University and served as a researcher. She says this upcoming winter is a mystery for COVID-19 cases.
I don't think anyone really knows what to expect. They are thinking it might go up because the last 2 years we've had peaks in the wintertime. But this year, because the variants are changing so much, it's sort of hard to tell.
Specker says the first SARS outbreak was able to be contained, but the COVID-19 virus could not, leading to different variants and difficulty eliminating it.
This particular SARS-CoV-2, that didn't happen. It got out of control and spread to, it's going to be pretty much, I don't know, I would say impossible to get rid of that virus now that it's so prevalent within the population, the world.
She says COVID-19 is becoming similar to the flu in trying to guess what it will be this year, but scientists are working to find a way to target more of the source than its changes.
I think a lot of people are looking at, well, is there another way of doing this where you can target something within that virus that isn't changing so much?
While they can't estimate COVID-19, Specker says they are able to estimate how the flu season will look by watching what happens in the southern hemisphere.
And this particular year, it was a pretty bad year for flu in the southern hemisphere, and the flu season started a little bit earlier.
Since it started early in the southern hemisphere, Specker says they are bracing for the possibility of an early flu season.
Typically, flu in South Dakota, the flu season starts the first full week of October, and it usually peaks around February. So when they say it's starting earlier, they think that peak is a little like maybe it's going to be in January instead of February.
They also expect the flu to be more dangerous than in previous years.
It's not only coming earlier, but it could be more severe. They have seen it to be more severe than it has been in the last couple years.
Specker says the CDC is advising people to be more cautious and be generally aware of their community's health, and to get the flu shot and new COVID-19 booster.
There's a new vaccine right now. It's the updated vaccine. It's a bivalent, and it's just easier to remember that it's the updated one. And it's a vaccine against not just the original COVID or SARS-CoV-2 virus, but also this Omicron BA5.